staff at Cure Americas, Guatemala. Imagine for a moment that you are busy running a 24-hour-a-day maternal health clinic, visiting patients in their homes, taking care of your own family, when 23 guests drop in for a 5-day visit. Well, this is what happened. This is what the Cure Americas staff had to deal with in Calhuitz, Guatemala, the week before last when our group from UPCC showed up. Despite their already full plates, they welcomed us with warmth, kindness, and generosity. Not only were our rooms all ready for us, clean, with beds made, but lunch was prepared too. Throughout our entire visit, in fact, these kind people, mostly women, fed us 3 tasty, nutritious meals each day, making accommodations for the 2 vegetarians among us, surprising us with treats such as homemade pineapple popsicles and hot chocolate, and trying out new recipes like their version of Beasley's chicken and waffles, which was chicken and pancakes. It should be noted that most of all the cooking was done with a wood-fired stove. In addition to feeding us and driving us to the various locations, such as other clinics and homes and villages for care groups and home visits, the women of the Cure Americas staff lovingly and skillfully cared for the women and infants who came to the clinics at all hours of the day, rejoicing in the newborn child and tenderly comforting the sick and the bereaved. They were also busy teaching new mothers how to best care for themselves and their children, and training other women in the community to share this knowledge. Some of these women have received formal nursing training and do receive a small stipend, while many of them are volunteers. Whether paid staff or volunteers, all of the women do what they do because they are passionate about decreasing maternal and infant mortality in their communities. And they know that by improving the health of women, they will lift up the welfare of the entire community. I would be remiss if I didn't mention among the staff 2 people who, while not in Guatemala full-time, have also passionately carried out the work of Cure Americas, Morgan Clark and Jane Thibodeau. Morgan had already been living and working in Calhuitz for 8 weeks by the time the UPCC folks arrived. She tirelessly cared for the sick, delivered babies, and with her refreshing, upbeat demeanor, lifted the spirits of everyone around her. Jane was our competent and fearless leader throughout the trip, and she was no stranger to the Cure Americas Guatemala staff. It was clear from the affectionate manner in which they all greeted her with hugs and kisses that they deeply love her and admire her, and they feel a deep gratitude to her for all she does to make their work possible. Our group from UPCC hopes that we made a positive contribution to the overall efforts of Cure Americas and their staff in Guatemala. We know, though, that we received so much more than we gave. Therefore, the least we can do is share what we learned and experienced with all of you, in the hope that you will also support Cure Americas and spread the word of the incredible work they are doing to save and improve the lives of mothers and children in the beautiful country of Guatemala. Thank you.